After more than 30 years without measles, Belize confirmed 2 cases of the virus on Saturday. Dr. Melissa Diaz-Musa, Director of Public Health and Wellness, said the group from 4 different communities in Belize traveled to Chihuahua, Mexico in January and returned on March 30th. The rest of the group is in isolation and showing no symptoms so far, with most of them being vaccinated. The patients are teenagers.
The details of the 2 positive cases are as follows. A 17-year-old male, unvaccinated, who started with fever, rash, and cough on April 3rd. Laboratory confirmation of measles was received on April 12th. The second case is a 17-year-old female, unvaccinated, who started with symptoms on April 2nd. Laboratory confirmation of measles was received on April 12th. All 15 travelers have been interviewed by the staff of the Ministry of Health and Wellness and are being monitored regularly for signs and symptoms.
Musa explained that they acted as soon as they got reports of patients with symptoms and waiting for test results to confirm measles. These cases come amid a surge in measles across the Americas, with over 500 confirmed cases in Canada, the US, Mexico, and Argentina. Although many people in Belize are vaccinated, the rate is still below the 95% target, especially in the Cayo and Belize districts. The Ministry of Health is urging Belizeans to get vaccinated.
The Ministry of Health and Wellness urges the public to ensure vaccinations are up to date, particularly for children. Parents, check your children's vaccine cards to determine if their vaccines are up to date. Adults who have not received an MMR vaccine or who are uncertain of their vaccination status should visit a health facility to receive the vaccine.
Any unvaccinated person traveling abroad and coming in contact with persons that may be infected with measles, more than likely will be infected with measles. So we have so many flights in and out of Belize, and if we look at the data in the US, a lot of destinations from Belize, they're having outbreaks.
Dr. Natalia Bear, the ministry's technical advisor for maternal and child health, urged everyone, especially those in certain age groups or with existing health conditions, to get vaccinated, particularly if they plan to travel outside of Belize in the next month. What makes this illness highly contagious is that patients can spread it even before they show any symptoms.
The person is contagious even before having signs and symptoms. So it makes it more difficult for one to say, well, I will stay away from persons that are ill with fever and rash, but the contagious period starts even before that. The high-risk group that we need to target now is unvaccinated children and teenagers, unvaccinated adults from 20 to 59 years, adults greater than 60 years, unvaccinated healthcare workers, immune-compromised persons, pregnant women, and the population living in communities with low vaccination coverage.
Measles usually starts with symptoms like fever, runny nose, red eyes, and a rash that begins at the hairline and spreads down the chest, back, and limbs, and the rest of the body. The illness typically lasts for about 21 days from the onset of symptoms. The ministry has started holding monthly mobile clinics in remote communities to give out vaccinations, but they've noticed that people are hesitant to get vaccinated. This hesitancy has increased since the COVID outbreak. Reporting for News 5, I'm Marion Ali.